Alright, hello and welcome everyone to this series on Mission May Mega Revision series of short subjects. My name is Dr. Jhanvi. I am the Anesthesia Educator on Unacademy, and I hope that all of you are able to see me and hear me well. Is the streaming okay? Please leave a thumbs up in the chat box if the streaming is okay and we can begin our class. Okay, my name is Jhanvi. I am a gold medalist in anesthesiology. This is the Telegram channel where we post the links to all of our classes. So you guys can join the Telegram channel and this will help you get the links to all the free classes that we take. The link is Let's Crack NEET PG. Okay, now along with this is the NEET PG free test calendar for March. You can attempt all these free tests every day and assess your preparation for NEET PG. The Plus subscription on Unacademy will help you get access to live and recorded classes. You can learn from India's top educators. You can compete in live tests and quizzes. You can study on the device of your choice and you can access our question bank with 25,000 plus questions. The iconic subscription on Unacademy will help you get the best of both Unacademy and Prep Ladder. So you can get the recorded classes of Unacademy and the live classes of Unacademy along with the video lectures and the notes of Prep Ladder. Now we are running this special Unlock 20 code for 2 days only. So today and tomorrow, if you use my code Dr.Jhanvi Live, you can get 20% off on your Unacademy subscription. These are all our FMG toppers, as you can see. Now in the special classes, we have interactive live classes, polls for the learners, raise a hand option, and lecture notes available as PDF. This is the NEET PG 2022 All Educator Revision batch, which is focused on the May NEET PG exam. This is the Focus FMG 2022 batch, with the focus on FMG exam. Now we already discussed all the basics of skin and a few other disorders like psoriasis, lichen planus and pigmentation disorders. Now we will be going off to some other diseases in dermat. So let's see the first one that we have over here. Yeah. So can you guys identify all these symptoms for me and tell me what is this disease? Collectively, can you identify this disease for me? Yes, very good, Shoaib. Absolutely correctly identified. This disease is nothing but dermatomyositis. Can you individually identify each of these symptoms for me? Not dermatitis herpetiformis, it is dermatomyositis. Can you individually identify the symptoms for me? Okay, so whenever you get the purplish lesions on the knuckles, that is called as Gottron's papules. Okay, then when you get the purplish lesions that are present over the eyes, then that is called as heliotrope rash. Then if you see purplish lesions present on the back, this is the area where you wear a shawl, correct? So this is called as shawl sign. And purplish lesion that you get in the front of the neck, this is called as V sign, because this is arranged in the front of the neck just like a V-neck t-shirt. Okay, so these are the lesions that are seen in dermatomyositis. Now in dermatitis herpetiformis, can you tell me, Anjana, what happens? Because Anjana got confused between dermatomyositis and dermatitis herpetiformis. Similar sounding, but can you tell me? Can you tell me what exactly do you see in dermatitis herpetiformis? Yeah, so in dermatitis herpetiformis, it basically causes problems of the lining of the stomach and the intestine, and you have effacement of the lining of the stomach and the intestine. Okay, yes, absolutely correct. So you will have a malabsorption syndrome. Patient will have protein energy malnutrition in case of dermatitis herpetiformis. Alright. Now, next question for you guys. Identify this sexually transmitted disease and then discuss all the important causative organism, description of the lesion, diagnostic tests, appearance of bacteria, treatment, and what is pseudobubo sign. Yes, absolutely correct. This disease is called as Donovanosis. What is the other name of this disease other than Donovanosis? Other than Donovanosis, what is the other name? It is also called as granuloma inguinal. Granuloma inguinal. Okay, what is the causative organism? All of you all have identified it correctly. So the causative organism is Calamantobacterium granulomatis. Calamantobacterium granulomatis. Okay, how do you describe this lesion? Anyone? So this is a reddish lesion that is present on the inguinal area as well as on the genitalia. Correct? Now, is this painful or painless lesion? If you tell the exact color, it is beefy red in color. It looks like the meat of a beef. Okay, so this is beefy red in color. It is painless lesion and it is velvety in nature. Beefy red, painless and velvety in nature. Okay, now can you tell me what is the diagnostic criteria for this lesion, or the diagnostic appearance, microscopic appearance of this bacteria that you see, which will help you identify that this is Calamantobacterium granulomatis? Very specific appearance of the bacteria. Okay, first of all, you are able to find Donovan bodies in this disease. Okay, and how does the bacteria appear like? So the appearance of the bacteria is something like this. So it is called as the safety pin appearance. Safety pin appearance. Okay, and what is the treatment? Treatment of this disease is nothing but azithromycin. Okay, now we have the pseudobubo sign that is seen in this. So what is the pseudobubo sign? So if you have enlarged inguinal lymph nodes, then that is called as the bubo sign. Okay, inguinal lymphadenopathy, that is called as the bubo sign. But in case of enlarged inguinal, if there are swellings that you see in the groin area which look like enlarged inguinal lymph nodes but they are not, then that is called as the pseudobubo sign. And the pseudobubo sign is seen in case of granuloma inguinal or Donovanosis. Please remember this, it's very, very important for your exam because this does come in your exam. Pseudobubo sign is seen in which disease? So that is seen in Donovanosis or granuloma inguinal. Alright? Okay, next question for you all. This sign is seen in which disease? Granuloma inguinal, lymphogranuloma venereum, syphilis or HSV? So you have to identify the sign and you have to also tell me that the sign is seen in which disease. Yes, absolutely correct. So what you see over here is you have your inguinal lymph nodes and your femoral lymph nodes which are enlarged, and in between the enlarged lymph nodes you see there is presence of a gutter. This gutter is also called as groove. So this is called as groove sign. Okay, this is called as groove sign or gutter sign. Now this groove sign is seen specifically in a disease which is called as lymphogranuloma venereum. Okay, so lymphogranuloma venereum you will see presence of groove sign. Now in lymphogranuloma venereum, the important thing to identify is what is the causative agent. So can anyone tell me the causative agent in this disease? Causative agent in this disease? Yes, it is Chlamydia trachomatis. Absolutely correct. So the causative agent in this disease is Chlamydia trachomatis. Okay, and what will be the treatment for this lymphogranuloma venereum? Wherever chlamydia is involved, what will be the treatment, guys? So in granuloma inguinal, the treatment was azithromycin. In lymphogranuloma venereum, what will be the treatment? Yes, same. Azithromycin only is the treatment of choice. Okay, alright. What is the drug of choice for the treatment of genital herpes? Famciclovir, ganciclovir, acyclovir or foscarnet? Okay. So remember, the drug of choice for treatment of any kind of herpes is actually acyclovir. Alright. But now tell me, out of all of the remaining 3 options, if you have acyclovir resistant herpes, then what will be your treatment? Yes, absolutely correct. For acyclovir resistant herpes, your treatment will be foscarnet. Okay. Now, can you tell me, HSV1 or HSV2 will be the causative factor in this disease? In genital herpes, what will be the causative organism? HSV1 or HSV2? Okay. So what you do is, if you're confused, you just draw a line along the waist of the patient. Okay. Any kind of herpes disease that is happening below the waist will be caused by HSV2. Any kind of herpes disorder that is happening above the waist, for example herpes ophthalmicus or herpes labialis, all of this is caused by HSV1. Okay, so that is your easy way to remember the causative organism for herpes. Alright, so all those who are coming in late, till now we have seen the signs and symptoms of dermatomyositis, we have seen lymphogranuloma venereum and granuloma inguinal, and we have seen about herpes. Okay, now next one, identify the lesion in this case: condyloma acuminata, gonorrhea, verruca vulgaris or molluscum contagiosum. Yes, absolutely correct. So you can see over here that there is presence of, how do you diagnose this? How do you describe this? Pearly white umbilicated papules. Pearly white umbilicated papules that are present. Okay, so these pearly white umbilicated papules, umbilicated means there is presence of a small dot over here. Okay, so this pearly white umbilicated papules that we have over here is telling us about molluscum contagiosum. Okay, so molluscum contagiosum, what do? You aspirate, or you take a small biopsy and you check what virus is present over here. So the virus that is present in molluscum contagiosum is nothing but pox virus. Okay, what is the characteristic lesion of this disease? Anyone? What is the characteristic lesion of this disease? What is the characteristic lesion of molluscum contagiosum? Anyone? Yes, so you have presence of these bodies which are called as Henderson-Patterson bodies. Henderson-Patterson bodies. Okay, or HP bodies. So this is what we see in case of molluscum contagiosum. Alright? Okay. Now moving on to our next organism. Identify this lesion in which the causative bacteria has a shoal of fish appearance on gram stain. And this is the shoal of fish appearance that you can see. Is it hard chancre, LGV, soft chancre or granuloma inguinal? This is the lesion that you can see. And this is the shoal of fish appearance of the bacteria. Okay, very good. This is nothing but soft chancre. Correct. So LGV and granuloma inguinal we've already seen. Can you tell me, hard chancre is seen in which disease? Anyone? Hard chancre is seen in which disease? Yes, hard chancre is seen in syphilis. Okay, so this is soft chancre and this is seen in a disease which is called as Chancroid. Can you tell me what is the causative organism in Chancroid? And other than shoal of fish appearance, there is also another name for this appearance of the bacteria. So what is the other name for the appearance of this bacteria? Yes, correct. Chancroid is caused by Haemophilus ducreyi. And the other name that you have for this shoal of fish appearance is nothing but tram track appearance. It is also called as tram track appearance. Okay, got it? Alright. It is also called as railroad track appearance. Absolutely correct. Okay, now all these are the stages of syphilis. You have to tell me the timeline of these stages of syphilis. Actually, it's given over here. So let's discuss. Primary syphilis is seen within 21 days of exposure. Secondary syphilis is seen within 4 to 10 weeks of exposure. Latent syphilis is seen after years of exposure, and tertiary syphilis is the one that involves most of the systemic disorders. So that is a severe kind of syphilis that causes complications. Okay, and again this is also seen years after exposure. So this is a timeline that you need to know about syphilis. Now let's look at the individual syphilis lesions. So in primary syphilis, first tell me what is the causative organism of primary syphilis. Causative organism of primary syphilis, and what is the lesion that you see in it called as? Yes, so the causative organism is Treponema pallidum. Absolutely correct. And what is the lesion you see in primary syphilis called as? Anyone? You all discussed with me before when we were doing the Chancroid bacteria. Yeah, so the lesion is a hard, painless lesion that is called as hard chancre. Okay, it is a hard, painless swelling which is called as hard chancre. Okay, now what is the most sensitive and specific test to diagnose this condition? Yes, absolutely correct. So the most sensitive and specific test to diagnose this condition is nothing but enzyme immunoassay. Enzyme immunoassay. Okay, so this is all that we have about primary syphilis. The causative organism is Treponema pallidum. Lesion seen as hard chancre, and the most sensitive and specific test to diagnose is enzyme immunoassay. Alright? No, it is EIA only. Okay. Now talking about secondary syphilis and its appearance, what is the name of the lesion in secondary syphilis? And these are the two lesions that we specifically seen in secondary syphilis. So identify both the lesions. One is here, it is present in the line between the buttocks, and one is present on the hair. And there is one more lesion, in that is the sign is called as Buschke-Ollendorff sign. So can you guys tell me what are these lesions called? Yes, on the hair you're seeing that you have certain areas of alopecia. This is different from alopecia areata, guys. In alopecia areata you will see bigger lesions of loss of hair, and at the end of it you will have exclamation mark sign. Okay, so that is called as moth-eaten alopecia. Moth-eaten alopecia. Okay, and what you see in case of the syphilis over here, okay, so in between the buttocks you see presence of these ulcerated lesions. This is called as nothing but condyloma lata. Okay, remember condyloma lata, not condyloma acuminata. Okay, this is called as condyloma lata. And can anyone tell me what is Buschke-Ollendorff sign seen in secondary syphilis? Any idea what is Buschke-Ollendorff sign seen in secondary syphilis? Yes, so if you feel tenderness along the anterior part of the tibia, okay, tenderness along the anterior part of the leg or along the shin of the tibia on deep dermal tenderness. So you have to press that area very hard, the anterior part of the tibia, and if you feel tenderness over there, then that is called as Buschke-Ollendorff sign. Buschke-Ollendorff sign is positive in secondary syphilis. Okay, so primary and secondary syphilis we have seen. In tertiary syphilis, we have involvement of the special organ systems. So can you tell me what is seen in that case? What do you see in the heart, what do you see in the brain, and what is gamma? Bolo. In the heart, what are the specific lesions seen in tertiary syphilis? In the brain, what are the specific lesions seen, and what is gamma? It is seen in tertiary syphilis. Bolo, bolo, bolo. Anjana, Rameshwar, Shoaib. Okay, at least one thing you all can tell me, in neurosyphilis, the brain is affected and the name of the disease that you have in that is tabes dorsalis. Barabar? What about in the cardiovascular system? What is the specific lesion that is produced? Two specific lesions are produced. One is related to the aorta, one is related to the valve. And what is gamma? Very good, Shoaib. So in the heart, you see presence of aortic aneurysm. And what happens to the valve? So you have aortic valve regurgitation. Okay. So this is also common, aortic valve regurgitation. Okay. And what is gamma? Anyone? Gamma is nothing but they are painless non-infective lesions, okay, that are present in tertiary syphilis. So they do not contain the organism and they are not going to be infecting other people around. So those are gamma seen in tertiary syphilis. Okay, so this is everything about syphilis. What is the timeline? What is the causative organism? What are the lesions specifically of primary? So of primary syphilis, it is heart chancre. Of secondary syphilis, it is your condyloma lata and moth-eaten alopecia and Buschke-Ollendorff sign. And of tertiary syphilis, the specific feature that you see is presence of gamma. Okay, so this is all about syphilis. Now moving on to our next disease. This is congenital syphilis. So can you identify the specific things that you see in congenital syphilis? What is 1, what is 2, what is 3? All seen in congenital syphilis. Okay, first you see the notched upper incisors, and these notched upper incisors are called as nothing but Hutchinson teeth. Barabar, Hutchinson teeth. Okay, then you see what is in the second one. Yeah, so in the second one you see there is presence of snuffles. And what about the nose? There is a depressed bridge of the nose. So what is that called? That is called as saddle nose. Barabar, that is called as saddle nose. And at the angle of the mouth you see that there is a little bit of a lesion. So what is that lesion called at the angle of the mouth? That is called as regards. Okay. Now what do you see in this case? This is your fibula, this is your tibia. On lateral x-ray you see that there is anterior bowing of the tibia. So what is this called as? Yes, saddle. Saddle is nose. I think थोड़ा पीछे चल रहा है मेरा वीडियो, and that is why by the time I come to the next picture you guys are seeing the previous picture only. ठीक है. So this is called as saber tibia. Okay, that anterior bowing of the tibia is called as saber tibia. Alright, absolutely correct. So all these three signs are seen in case of congenital syphilis. Okay. Alright, so now let's move on to our next disorder. So that is acne. Acne के बारे में question तो हमेशा आता ही है. First thing that they ask is what glands are affected. So you should know that these are the pilosebaceous glands that are affected. Okay, what is the causative organism of acne? If you all want to discuss the pathophysiology of acne, I will. Otherwise, I think it is everyone knows about it. You have a hair follicle coming from here. This hair follicle is provided by this pilosebaceous gland. Okay, now if these are also pilosebaceous glands. Now if there is any kind of this is the skin from which the hair follicle is coming out. If there is any blockage in the flow of the pilosebaceous gland ka discharge, then there will be inflammation of this gland, so it will enlarge in size. And if there is any kind of secondary infection over here, then this gland will become inflamed and red and it will present like acne. Okay, yeah. So the causative organism that causes acne vulgaris is Propionibacterium. Okay, causative organism is Propionibacterium. Now, can you guys tell me what is blackhead and whitehead? Or what is open comedone and closed comedone? Those are the first stages that you see of acne. Because of blockade of the pilosebaceous gland, you see formation of comedone. That is the first stage of acne formation. So you have open comedones and you have closed comedones. So which is blackhead and which is whitehead? Okay, so the open comedones are called as blackheads and the closed comedones are called as whiteheads. In open comedone, you will have obstruction at the level of the skin. In closed comedone, you will have obstruction below the level of the skin. Okay. Now, after you have formation of comedones due to obstruction, the next thing that you will have is inflammation. There will be inflammation of these comedones. Then there will be secondary infection of the comedones, and these leads to formation of pustular comedones. Okay. Once they become pustular, then they become large in size also, so they become nodular pustular in nature. And finally, there is formation of acne conglobata. Acne conglobata. Okay. Now, can you tell me what will be the treatment? If I want to treat at this level only, the patient is coming to me with presence of pustular lesions. What are the drugs that I can give? Chalo, sabko hua rahega acne, so you can tell me easily. What are the drugs that I will give? When the pus starts coming, they say, don't break the pimple or don't touch it. It can lead to more infection. And then they give you those topical, very expensive antibiotics to put. So what are those topical, very expensive antibiotics to put? Topical retinoids are not given at this stage. Can you tell me the expensive antibiotics that you use? Yeah. So the expensive antibiotics that you use is clindamycin and clarithromycin. Clindamycin and clarithromycin. These are the two antibiotics that are used for the treatment of acne. So if you want to kill the Propionibacterium, then you can use these two. And orally, if you want to give, then you can give doxycycline to the patient. Alright. So because we are talking about the treatment of acne, let's come to a question. Which of these drugs cause acne? INH, rifampicin, anabolic steroids, oral and topical steroids, or all of the above? Which of these drugs cause acne? Okay, yes, the correct answer is E. All of these drugs cause acne. So you must have seen many people after TB, after receiving AKT, they develop a lot of acne on their face. That is because one of the causative factors is isoniazid and rifampicin. Okay, then steroids also cause acne, and oral, that's why young guys who are trying to pump up in the gym get a lot of acne, and oral and topical steroids can also cause acne. Alright, so that's about acne. Now identify these two lesions and tell me which is abnormal, which is normal. Identify one and two. Freckled? No, these are not freckles. Okay, what is happening in the axilla over here? You have obstruction of sweat glands. So you are getting this, and here you are getting something which is unusually present in a place where it should not be there. Okay, yes, Shoaib, absolutely correct. So one of these Shoaib has answered correctly. This one is called as ectopic sebaceous glands present on the upper lip. Okay, so can you tell me what is the name of those ectopic sebaceous glands? And here you have obstructed sweat glands. There you have ectopic sebaceous glands. Here you have obstructed sweat glands. Very good, Fez. Fez, welcome to class. Where were you? Okay, so the ectopic sebaceous glands are called as fordyceous spots. Okay, and the obstructed sweat glands, what do you call them? This is a disease. This is due to obstruction of the sweat glands. So it is not a normal thing that is happening. So what is the name? Yes, this is called as Fox fordyceous disease. Fox fordyceous disease. Okay, yeah. So you have Fox fordyceous disease and you have fordyceous spots. Alright. Now these are the leonine faces that you see in case of leprosy. The face of this patient is looking like that of a lion, and that is why it is called as leonine faces. So due to diffuse dermal infiltration of the face, she gets these lesions. The other features that you can see in case of leprosy is presence of saddle nose and loss of eyelashes and eyebrows, called as madarosis. Now this madarosis that you see, loss of the lateral half of the eyebrows, is also seen in another allergic condition of the skin. Can you tell me in which one? Can you identify in which allergic condition do you see madarosis, and what are the other things that you see in that? This is how you study and revise. Okay, you read one thing and then you try to connect कि हाँ ये तो वो disease में भी दिखता है, वो disease में भी दिखता है. Yes, very good, Rameshwar. So madarosis is also seen in atopic dermatitis or in eczema. Okay, so in atopic dermatitis there is another sign that we see below the patient's eyes. So in this area they will get a lot of folds. Can you tell me what is the name of that sign seen in atopic dermatitis? Presence of many folds over here. Yes, that is called as Denny Morgan fold. Okay, that is called as Denny Morgan's folds. And what is the name of the other sign that you see in atopic dermatitis? So the child will be having perioral pallor. What is the name of that sign? Perioral pallor. Perioral pallor, that is called as headlight sign. Okay, so we have Denny Morgan folds, headlight sign and madarosis, which are the three things that are seen in atopic dermatitis. Alright, okay, moving on to our next disease. So now we are going to study about the hair. So you have to tell me about the hair cycle. What are the important parts of the hair cycle? What are the three important parts of the hair cycle? There are three phases in the hair cycle. एक तो नीचे ही लिखा है telogen effluvium. What are the two other phases that are there in the hair cycle? Anagen phase, catagen phase and telogen phase. Okay, so you have to tell me which is the growth phase of the hair in this case. Growth phase of the hair is seen in which case? Which phase is the growth phase? Growth phase is the anagen phase. Barabar? Now, in telogen effluvium, usually you have to tell me in which condition does telogen effluvium phase get prolonged. Telogen effluvium phase gets prolonged in which case? Growth phase is anagen phase barabar. Telogen effluvium phase gets prolonged in which case? There is shedding of the hair in this phase, and this is usually seen for 3 to 6 months. Okay, and this is usually seen after a patient has had a severe illness like typhoid or TB, or if the patient has been on long-term immunosuppressants. So, or stress exam के बाद जब you have hair fall ना, that is because of telogen effluvium phase. Okay, so this is how we have the hair cycle. Now before we go on to the hair cycle, there are a few questions that were left to ask you guys about leprosy. So you have to tell me what is the other name of leprosy, what is the name of this disease, what is the causative organism, then you have to tell me what is the most commonly involved nerve in leprosy, overall most commonly involved cranial nerve in leprosy, and most common type of leprosy in India. You know, we have we have the borderline tuberculoid, you have the tuberculoid type, BB, BT, TT, all those types. So you have to tell me what is the most common type of leprosy in India and what is the name of classification of leprosy. Okay, so I can see that the answers are already coming over here. Alright, yes, the other name of leprosy is also called as Hansen's disease. Barabar. What is the causative organism? It is nothing but Mycobacterium leprae. What is the most commonly involved nerve? Greater auricular nerve. No, ulnar nerve is the most commonly involved nerve in case of leprosy. What is the most commonly involved cranial nerve in this case? Most commonly involved cranial nerve, anyone? Yeah, so the most commonly involved cranial nerve, absolutely correct, Rameshwar, is the facial nerve. Okay, because the ulnar nerve is involved, you see presence of ulnar claw hand in these people. Have you seen anyone suffering from leprosy? They have ulnar claw hand. Okay, then most commonly involved cranial nerve is facial nerve. Most common type of leprosy in India is the borderline tuberculoid type. And the classification of leprosy is called as, very good Anjana, classification of leprosy is called as Ridley-Joplin classification. Ridley-Joplin classification. Okay, yes, absolutely correct. So this is all about leprosy that they ask in the exam. These one-liners you guys should know about. Okay, then a few other questions that they ask about leprosy. What are the histiocytes that contain the lepra bacteria called as? The histiocytes that contain the lepra bacteria, they have a specific name. What are they called as? Then what is the most common organ that is involved in leprosy? In males, what is the most common organ involved? And in females, what is the most common organ involved? Okay, and then what is the paucibacillary leprosy? And what is multibacillary leprosy? Means what is the diagnosis or definition as per the number of bacteria? तो ये भी बताओ सर. Okay, good. So the histiocytes plus leprae bacteria together are called as Virchow cells or Virchow cells. Most common organ involved in males, anyone? Yes, very good Anjana. Most common organ involved in males is the testes. Most common organ involved in the females is liver. Now when do you call it as paucibacillary and when do you call it as multibacillary leprosy? Pauci and multibacillary leprosy. Okay, paucibacillary leprosy when there are less than 10,000 bacilli per gram of skin. Okay, and multibacillary leprosy when there are more than 10,000 bacilli per gram of skin. Okay, then there are 3 cardinal signs for diagnosis of leprosy. What are they? Final question about leprosy. 3 cardinal signs for diagnosis of leprosy. Can you tell me what are those 3 cardinal signs? What are those 3 cardinal signs to identify leprosy? Yeah, So the first one is hypopigmented patch. There should be a hypopigmented patch with impaired sensation. Okay, so the sensation should also go from there. The next thing is, when you take a biopsy, you should be able to find acid fast bacilli on smear. And the third thing that you should be able to find is thickened peripheral nerve. Okay, so these are your three cardinal signs of leprosy: hypopigmented patch with impaired sensation, acid fast bacilli on smear, and thickened peripheral nerve that is present. Alright. Okay, now moving on to back to our hair. So we had discussed about the three phases of the hair cycle. So we had anagen, catagen and telogen effluvium phase. Now you have to tell me about the alopecia. So this is the typical type of androgenetic alopecia that you see in males and in females. So you have to tell me what is the specific difference between the male pattern hair baldness and the female pattern hair baldness. 1 second, I'll just switch off the fan and come. What is the main difference between the male pattern baldness and the female pattern baldness? Mohan Priya, minoxidil is given for the treatment. Yes, you can see in the picture only and tell me. You can identify in the picture only and tell me. Yeah. So you see where the hair is lost. In the male, the hair is lost on the crown and there is presence of receding hairline in the front. Okay. So your hair loss is on the crown and receding frontal hairline. Okay. So this is your male pattern baldness. And in female pattern baldness, what do you see? Yes. So in the female pattern baldness, you will see that there is hair loss in the center. Okay. So there will be central hair loss seen in female pattern baldness. Okay. So this is between male and female pattern baldness. Okay. Now, what is the causative factor of androgenetic alopecia? It is dihydrotestosterone, correct? So what will be the treatment? The treatment will be to reduce the dihydrotestosterone levels. How do we reduce the dihydrotestosterone levels? The most effective way is to give the 5-alpha reductase inhibitors such as finasteride. Other drugs that you can give is 5% minoxidil. What does minoxidil do? The anti-androgenic agents will basically reduce your 5-dihydrotestosterone levels. Okay, like cyproterone, spironolactone, flutamide and finasteride. What will minoxidil do? Minoxidil's mechanism of action is not the same. It is a little different. So can you tell me the mechanism of action of minoxidil in this case? Yes, absolutely correct, Anjana. So minoxidil causes vasodilation. So when it causes vasodilation, it improves the circulation of the root of the hair and there can be hair growth. Okay. Yeah. So yeah, it is a potassium channel. It affects the potassium channel. So please remember, there are two different ways of action. One is by blocking the androgens and second is by vasodilation. Okay. Now this is alopecia areata, in which you have patchy hair loss. It can be autoimmune in nature, and the specific thing that they ask this many times in the exam is exclamation mark sign is seen where. So at the edge of this hair you see exclamation mark sign. The hair that is present on the edge of the alopecia, it is called as exclamation mark sign. Now can you tell me alopecia areata is associated with which dermatological disease? We actually saw that dermatological disease today. So alopecia areata is associated with which dermatological disease? Okay, not pitting of nails, but it is associated with lichen planus. Okay, lichen planus is also an autoimmune disease, and alopecia areata is also an autoimmune disease, and both of them are associated with each other. Okay, all right. Now, can you identify picture number 1 or condition number 1 and condition number 2 for me? They both are different. So let me define for you. I think picture number 1 and 2 look almost the same. So this patient is having hair loss. Number 1, he is having hair loss all around the face. Okay, face and neck region. And in number 2, she is having loss of hair everywhere, the entire body. So which one is alopecia totalis and which one is alopecia universalis? Yes, absolutely correct. So picture number 1 is alopecia totalis. Okay, so in alopecia totalis, he is lost hair only on the head, face, neck area. So he is only lost hair on the head. But in picture number 2, she does not have eyebrows also, and she does not have hair in any part of the body, as I told you. Okay, so that is why she has lost hair all over the body. So that is called as alopecia universalis. Okay, all right. And then we have the nails. So try to start identifying each of these nail conditions for me. What is number 1, with which diseases is associated? Number 2, I'll write it over here. Then number 3, number 4, number 5 and number 6. Bolo. Yes, so 1 is seen in, this is pitting of nails. Pitting of nails, it is seen in which condition? Psoriasis. Good. Very good, Rameshwar. 4 is nothing but Mees lines that you see in arsenic poisoning. Three is not koilonychia. Okay, 2 to batao. 2 is very easy. No, it is not tinea angium. You are seeing presence of a wing, correct? We saw this earlier. Presence of a wing is pterygium. What disease is pterygium seen in? Yes, very good. 6 is correct. Complete destruction of the nails by fungal infection. So this is called as onychomycosis. Yes, pterygium is seen in lichen planus. What do you see in number 5? Anyone? Again, you are seeing presence of these lines. They are present in which condition? This is seen in hypoalbuminemia. Hypoalbuminemia. Okay. Yes, and 3 absolutely correct, Mohan Priya, is platinichia or flat nails. Okay, platinichia. Alright. So these are all the disorders we see in nails. Okay. Now, identify this lesion that is present over the patient's eyebrow and tell me the reason for it. Alright, So what do you see over here? You see there is presence of a bluish patch that is present right above the eye of the patient. So this is called as what? Nevus. Nevus over the eye. Remember that. I always write it like this. Nevus over the eye. Okay, over the eye. That's how I remember. So this is called as nevus of Ota. Why do you have nevus of Ota? This is bluish color because of melanocyte aggregation in the dermis. Whenever the melanocytes aggregate in the dermis, you will get a bluish colored lesion. Okay, so let me show you a similar bluish colored lesion over here, present over the back. Now tell me, what is the name of this lesion? Again, this is because of melanocyte aggregation in the dermis only. Very good, Rameshwar. So this is called as nevus of Ito. Nevus of Ito. Okay, so this one is nevus of Ota and this one is nevus of Ito. Then what is this? Sorry, what is this? Okay, very good. So I'm so sorry, 1 second. Yeah, so this lesion that you're seeing over here, this is commonly seen in males and at a very specific age, that is at puberty. Okay, so what is the name of this lesion that you see? This is called as Becker's nevus. Now can you tell me, Becker's nevus, why is it brown in color? Both these nevi are blue in color, but Becker's nevus is brown in color. And one very specific feature about Becker's nevus, other than the fact that it occurs at puberty, is presence of this hair that is present on top. Yes, absolutely correct. So in Becker's nevus, you are having aggregation of melanocytes. In the dermis. Aggregation of melanocytes in the epidermis. I'm so sorry. Whenever you have aggregation of melanocytes in the dermis, it will be a blue colored lesion like this, nevus of Ota and nevus of Ito. Whenever you have aggregation of melanocytes in the epidermis, it will be a brown colored lesion. This is an androgen sensitive lesion, absolutely correct as mentioned by Anjana. That's why it occurs at puberty. Any treatment for this? Will you want to give anti-androgenics to stop the growth of this lesion? Not really, because at puberty they have the maximum androgen secretion. So with time the lesion becomes self-limiting. It will not disappear, but it will become self-limiting in nature. So this is your Becker's nevus. Alright. So with that, let's just quickly go through the entire skin revision that we have done today. So quickly showing you everything that we have done today in 2 sessions. So first of all, we started with the layers of the epidermis from outside to inside, and what are the specific features of those, what are the cells of the epidermis and what are their functions. Then we discussed some pre-malignant lesions, some pigmentation disorders like pityriasis alba, vitiligo, melasma, P. baldism, pityriasis versicolor and acanthosis nigricans. Then some nevi like nevus acromicus. Then these were the lesions of tuberous sclerosis, all 4 of them. Then we discussed the whole of psoriasis, its treatment, Kobner's phenomenon, and psoriatic hand changes, psoriatic nail changes, and bedside test for psoriasis. Then we discussed a little bit about the connective tissue disorders like discoid lupus erythematosus and SLE. Then a little bit of psoriasis, and dermatomyositis was also part of the connective tissue disorders. Then we discussed about all the different sexually transmitted diseases like granuloma inguinale or Donovanosis, then your Lymphogranuloma venereum, herpes, Molluscum contagiosum and soft chancre, and then finally Syphilis, Chancroid, and then finally Syphilis. Okay, so in Syphilis we discussed primary, secondary, tertiary syphilis and all the important lesions that are seen associated with it, and congenital syphilis and the important lesions. Then we discussed acne, its most commonly asked questions like stages and drugs causing acne. Then we discussed the fordyceous spots and foxfordyceous disease and what is the important difference between the 2 of them. and then we discuss leprosy little bit in detail and the one-liners asked on leprosy. Then we discuss the stages of the hair cycle and what are the features of androgenetic alopecia, alopecia areata, alopecia totalis, alopecia universalis. Then we discuss the different nail conditions, and finally we topped it off by discussing about nevi, both the dermal and the epidermal nevi. Okay, so that's it for today's class. The PDF will not be available because YouTube classes PDF is not available. You can just watch this at 1.5x the speed when you want to revise. It's a great revision for skin. And tomorrow we are going to be having 2 sessions. One will be at 7 p.m. 7 to 8, and the second will be 8:30 to 9:30. In one we'll be discussing all the x-rays from all different subjects that come commonly in the exam, and the second we'll be discussing all the image based questions that come from different exams. Alright, so I hope that this class was useful to you guys. If you did like this class, don't forget to leave a thumbs up at the end of the class. Also don't forget to subscribe to this channel, Let's Crack NEET PG, because whenever I take classes, before the classes to be conducted, the night before, I post the links to the classes over here on this NEET PG group. Alright, any doubts that you guys have, or shall we move on to concluding the class? If anyone has any doubts, please do let me know. Okay, no doubts? Alright, so we shall conclude our class for today. Wishing you a very happy evening. Make sure that you continue with your revision series, and I shall see you tomorrow 7 to 8 and 8:30 to 9:30 p.m. Till then, take care, bye bye, and keep studying. Bye.